EHMA conference, it's an important place for a lot of stakeholders. And this year it was a mixture, I would say, given also the main theme about the health ecosystem, in which we have key stakeholders from decision makers, and the Romanian Minister of Health participated in the first day and welcomed the conference in Romania, towards decision makers from other health institutions like hospitals, dispensaries, institutes of public health, and so on, and researchers, academics, and people who are working in the health field. From our perspective as co-host, the Institute of Health Services Management, it is a success bringing those people together, and also the multitude and the variety of topics which cover the whole management area, and even more the whole public health area, from vaccines to leadership, to put it in very few words.
It's been fantastic to be in lovely sunny Bucharest for the conference this year. I've been particularly inspired by the fact that there's such a range of different attendees and speakers from across Europe. We have people from Slovakia, Spain, Sweden. We even have someone I spoke to who spent 2 days traveling here from the Caribbean. And I think it's a testament to how inspiring and exciting the different sessions we have at the EHMA conference this year.
It's been a real pleasure to participate in the EHMA meeting this year also. I would say there have been many very interesting sessions. They have been dealing with, for example, financing the investment in equality in the healthcare system, AI approaches, and many other new emerging things. And all of those are of extreme importance now that we are navigating to the future.
It was a great conference. The topics that were covered were really on the spot of what is the health managers. Unfortunately, lack of time for some of the discussions that we had. It would have been wonderful to have an extra hour to get deeper into the topics, but then of course, it is obvious that if we have more time, there will be less topics to be covered. So this is a trade-off that I think it was properly managed anyway.
This year, the topics that were addressed are very relevant, really talking about the big challenges affecting health systems, but also looking at practical solutions and how we can work together to implement them. I think the value of this event is really to have practitioners, policy experts, but also a wide range of stakeholders who are all motivated by the same purpose, improving public health and patient outcome across the 27 countries and beyond.
As a member, an EHMA member, I would highlight two main benefits. Of course, and first of all, it's a very rich human experience. Through meeting amazing people, amazing professionals, experts, I do believe EHMA conference is a space for freedom, for free exchanges, for friendly exchanges. Perhaps it's because all of us are outside of our national environment, and so we feel freer than in our national environment. And the second main benefit is it's an experience, of course, a very rich professional experience, sharing projects, sharing achievements, studies, results, even failures, because it's sharing experiences in a very friendly environment. So I'm very proud to be taking part in EHMA conference, because I feel it's making difference by contributing to the launch of something like Europe Europe of health, Europe of healthcare.
It's not only very engaging, it's very interesting and it's relevant. I think the topic innovation and its ecosystem hits really the nail, something which everybody can relate to, and we know how important it is. Innovations will hopefully play the trick to improve the performance of our health system. And actually we started today with a fantastic plenary with the Romanian Minister of Health, and that was followed by a couple of masterclass. We ourselves delivered a masterclass on knowledge brokering, and then we had another plenary.
For us at the European Observatory, the EHMA conference is one of the central activities that we undertake every year. It gives this very rare and powerful mix of academics looking at organizational change and reform and transformation very much at providers level, together with actual practitioners that are engaged in these activities. Getting that mix together of science, analysis, and management practice is absolutely what we need in the current state of our health systems, which is all about transformation and reform. And this year has been a lot about a central question for our policymakers. How do we harness innovation? How we transform our health systems in a way that they adopt, integrate, we get value for money for all this innovation, both technological as well as organizational innovations. And looking at all the various plenaries and various sessions, we hear both the overall strategy how to tackle innovation and integrate innovation, and as importantly, the actual case studies, the practice, the detail about the transformation and implementation.
Theme shaping and managing innovative health ecosystem. In fact, it mirrors WHO focus on strengthening health systems to be more adaptive and more resilient and more responsive to the needs of the populations they serve. From the digital transformation of health systems and services to the ever-growing importance of sustainability, to the evolving skill set required by healthcare workforce, we emphasize on an ecosystem approach to promote collaboration among all stakeholders. So the conference this year facilitated dialogue on how different actors in the healthcare system can work together and leverage each other's strength to drive innovation and address pressing challenges. So keep up the good work and see you next year.
I think this year the conference has been excellent, the organization has been really good, and I think there has been top-level panelists in the sessions, and I think the topics have been really relevant. I think the European Health Management Association has a critical role to play to improve and strengthen health service management in the region, and that's critical if we want to improve quality of care and if we want to improve health outcomes in the region. And I would say, in addition to that, I really liked that this year there was a very important focus on health workforce in many of the sessions, because I really believe that we need to take into account and put health and care workforce at the center if we really want to move forward and transform health systems in the European region.
The EHMA conference this year is really an engaging forum for us to show that all actors in the ecosystem of healthcare have the willingness to drive positive impact for patient care. And I'm especially encouraged to see that the big barrier we see on a day-to-day basis are being addressed, like patient access, technology adoption, healthcare workforce availability or capability. So I'm confident that with engagement this week,
we will make sure we drive impacts for the patient population across Europe.
The EHMA conference is a unique opportunity to put together professionals and academics from different countries, and it represents a moment in which we can meet in person our colleagues from different countries in Europe and discuss with them about the different and the crucial topics of healthcare management, following different perspectives. This year we are very excited to be in Bucharest. This is the first time for the EHMA conference. By the time the EHMA conference has become a sort of community of practice in which year by year a growing number of healthcare professionals and academics and scholars stay together in a sort of community of practice, because connection is very informal, and also the way in which the relationship are growing. By coming back to the session, to the different sessions, for example, in the morning, the program director group to which I belong has organized a very interactive session about how to effectively teach the leaders of the future. And in this session we have discussed about, for example, how to engage Gen Z, or how to measure the impact of the training programs, or how to deal with artificial intelligence. So a very huge and wide different aspects that can be useful both for academics but also for healthcare professionals. I'm very glad to be here, and I'm very glad to attend also this year the EHMA conference.